Hello everyone, thanks for joining us here on Horizon. Well, today our focus is on a subject that makes many uncomfortable, yet impacts almost every family. From bouts of depression to full-blown schizophrenia, mental illness is just that, an illness that affects a growing number of Oklahomans. Joining me now is our Andy Barth.
Well, Rob, it's the biggest health issue in the state. With 1 in 4 Oklahomans suffering from a mental illness, many find it more and more difficult to find treatment, an issue that has many calling for change. It's an uncomfortable topic for families, for schools, and for businesses. But the impact of mental health affects all Oklahomans.
We need to really begin to change our attitudes. We still have a very archaic attitude about the realities that mental illness is a part of life.
Mike Brose is the executive director of the Mental Health Association in Tulsa and says work must be done to reach mentally ill Oklahomans more efficiently.
We've got to figure out how to move upstream and how to do more preventative work, more education. We need to start at younger age.
And for mother Shelly Cademy Munoz, mental health in young people is part of her daily routine.
I adopted 3 older siblings from foster care. Both of my older kids have been institutionalized multiple times, and it's been really tough to find resources for them.
Munoz's children have a condition called reactive attachment disorder, a condition that hinders a child's ability to establish healthy relationships due to abuse. And Munoz says finding help was difficult.
Shadow Mountain is the only facility in the entire state of Oklahoma who has beds available for kids with reactive attachment disorder.
Now, the lack of mental health treatment in the state is not uncommon. Nearly half of Oklahoma's private therapists don't accept health insurance. And according to the Federal Substance Abuse and Mental Health Services Administration, Oklahoma has the 2nd highest rate of adults with mental illness. And on the other side, we're the 7th lowest state that offers mental health funding, leaving many families with limited options.
The biggest problem is our system does not handle mental health like any other health issue, and it is just like every other health issue.
Kathy Dossie has been a pharmacist for more than 3 decades and has had numerous break-ins where prescriptions were taken. Yet her experience goes beyond stolen drugs. Dossie's daughter was in a car accident in 2011. The driver, her drunk husband, changing both Dossie's and her daughter's life forever.
She was instantly paralyzed from a C4, C5 spinal cord injury. And because it had been his 3rd DUI, he left her there and had somebody come and get him. Obviously, she was paralyzed, couldn't move. They called 911 after the fact for them to come and get her after they left. I was supposed to be a quadriplegic, and she was for about 6 months. And we just kept fighting, and we beat it. She passed her driving test in October of that same year in a car with no handicap controls. She works with a cane.
Yet that was only the beginning of her struggles.
The medications that she had been given were not solving the problem. The problem was that there is pain. There is internal pain, not physical pain, mental pain, emotional pain, from someone leaving you to die in a car that you're married to with a 2-month-old child.
Dossie's daughter turned to street drugs to help mask the pain, a common occurrence with those suffering from mental illness. Yet, unlike Dossie's daughter, many Oklahomans suffering from mental disorders are sent to prison, something Brose says needs to change.
We need the legal community, the mental health community, the substance abuse community, and the law enforcement community. We need to come together and really put our best minds around developing a protocols so it doesn't keep moving downstream and suddenly what was a medical mental health need suddenly becomes a law enforcement incarceration issue.
And Brose says the best way to start the discussion is to stop ignoring the issue altogether.
I'd call them, people are still ashamed, they're still embarrassed, they don't want to talk about it. We don't talk about suicide or threat of suicide. We don't want to talk about schizophrenia, bipolar disorder, shame, embarrassment in families, and the little secret nobody wants to admit or talk about, it's in every family.
Which fuels Dossie's frustration when doctors don't treat mental illness like any other health condition.
You wouldn't think for a minute of a diabetic going into a hospital, showing up in an ER with blood sugars of 600-700. You wouldn't think for a minute of treating them for a few days and then turn them loose with nothing else. No blood sugar control meds, no blood sugar strips, no machine. You wouldn't even consider that. But we do it every day in mental health. Every day.
Families struggling, supporters at a loss for direction, and patients left in the dark. Now, Oklahoma's population is 3.8 million. Of that, up to 950,000 Oklahomans suffer from mental illness. That's 25% of our population. And Rob, it's a number that could easily go up if the system isn't changed.
So of that 25% that need mental health services, how many actually get it?
Well, Rob, it's another troubling number that 70% actually don't get mental health treatment. It takes a lot of time, persistence, and money, and it's really, really expensive. For example, Kathy Dossie, who we heard from in the story, her daughter was checked into a private inpatient rehab facility. That price tag, $18,000 a month.
Wow, certainly a startling number. Thanks so much, Andy. Now, a little later in our show, we will look at the cost mental illness has on our legal system. But when we return, a conversation with the Commissioner of Mental Health and Substance Abuse Services for the state of Oklahoma.